Would you join me in prayer? Father, here we are. This is a time of celebration, and yet it's occurring in the time of unprecedented floods with people's homes being washed away and people's livelihoods called into question. All the people, including one of my daughters, who depend on tourists for their income. So, Father, we're mindful of that as well. I think as we come to this ceremony today, that you and your word in Psalm 100, each one of us, since we've been conceived in our mother's womb, and you've gifted, I would thank you that you've gifted people like all these nurses and other staff with hearts that are caring and the intellect to be able to grasp and manage all the medical stuff that keeps changing the medical as the field expands and their needs to stay on top of things. Thank you for that they have the compassionate hearts combined with the intellect to be able to do these things and to bring sweet, gracious, and tender care to those of us who have been patients or people who will be patients. Father, we give you honor and glory. It's been a long couple of years. There's a lot of people, Father, who are just carrying heavy loads. May this be a time of celebration, and may you, through your grace, touch hearts with your love and tenderness. Be with us now. I ask this in your name. Amen.
Amen. Thank you, Scott. All right, I think we'll go ahead and start honoring our award recipients. Okay.
Can everybody hear me? Yes. Excellent. I do have a voice that carries, I've been told. So I'm Deanna Block, and I'm the Director for Nursing Practice and Quality, our Magnet program and our Center for Education and Development, and I've had the privilege of also working over the past 6 months with our inpatient women's and children's teams. I've had a career here of about 18 years, and so there is a lot of longevity in this organization, and for that I'm super proud of. We also embrace every newcomer that comes in our doors as well. So today it's an honor for me to actually be able to do the emceeing of this. We usually do this during Nurses Week, but we're an adaptable organization, as we've known over the last couple of years, and we had to adapt this year as well. So bear with us, because we have some really incredible nominations and winners of our Nursing Excellence Awards. So we'll start off today with our Outstanding Nursing Support Staff Award. This Support Staff Award is for any staff member that supports nursing, because we are in Nursing Excellence Awards right now. And the first one that I want to highlight is Haley Liam. She is a CMA from Billings Clinic Bozeman Pediatrics. And she was nominated by Dr. Claire Canamore, Jody Daigle, Gary Hamilton, Dr. Sheila Izarada, and Dr. Courtney Hanlon. So Haley helps our department provide quality care every day by always putting the patients first. During COVID, we basically had a drive-up service that was hard work. Never once did Haley complain. She is always making sure the patients receive fast, quality care. She is always calling the family with results in a timely manner so they would not have to worry about their child. We can always count on Haley to participate in new initiatives. She is a stickler for details and staying organized, and comes up with ways to keep a busy office flowing when we are double booked. Haley is always seeing ways she and others safety standards, cares for each patient individually, and knows them well. She also is a great investigator for processes and questions. She never complains about new process improvements and adapts well, in fact, teaching others how to do that. She has come up with ways to manage patients in the parking lot during our busiest COVID testing times, and if she thinks a family is particularly worried or needing an immediate answer, she'll come straight to the staff and not let us send a message for us to address at the end of the day. She remembers every child's name and their siblings, and oohs and ahs over how cute they are at every visit. This is genuine and spreads cheer amongst the staff. If a department doesn't have that person, they don't know what they are missing. Haley is the voice for the patients and parents. She is always observing the small details when it comes to our patients, knows them well, and can see what needs they may have. Although Haley displays all of the PSE examples, I have to say some of her best characteristics that reflect our PSE standards are personal accountability and always strive to exceed. Haley demonstrates a commitment to the Billings Clinic core values, and she is fair, cheerful, and follows a professional approach. It is nice to have a person on our team who has a sense of urgency and quickly resolves issues when presented in the clinic. Haley signifies a positive image and strong team approach with clinical care in our office. For that, we'd like to thank you, Haley. Have a wonderful day. Second award we have today is for Loranda Bell. She is a CNA from Inpatient Surgical, and she was nominated by Marina Folkers. Lorenda's work quality is outstanding. If she is involved in a task, I know it is going to be done well. Her quality is consistent and reliable. She goes above and beyond in taking care of her patients, especially if they are here for a long period of time. She puts in the to tackle the personal care needs of those patients. Loranda always communicates with the nurses she is working with and makes a plan for the day. She keeps an eye out for things with her patients and will let the nurse know if there is a new change in the patient. For example, there have been a few times where she has been the first one to catch skin breakdown on a patient and has let me know about it so it could be assessed, documented, and treated. Loranda works well with her team of nurses and checks in with us on a professional level. She genuinely cares about her coworkers and her patients. She recognizes care needs in patients and emotional needs in them as well. She will set up spa days and make sure to be on top of the standard hygiene needs such as bed, bath, and hair washing. She will braid their hair so that it doesn't get matted and paint their nails for added confidence and time to spend with them. Those patients who have been here long term need those added comfort and care tasks that let them know we are here for them and care about them. Loranda acts as a unit role model and mentor by precepting new staff. She does her job thoroughly, and her high quality work encourages the same out of her preceptees and even other co-workers. She is always full of energy and has a positive attitude about every situation, which is infectious to our other co-workers. Thank you, Loranda. Our next winner is Scott Snowden. He's a monitor clerk from the CVU, and he was nominated by all of his CVU coworkers. Scott is a member of the CVU Partnership Council. He brings concerns of the other monitor clerks to the table and gives them a voice. He helps to improve workflow processes as well as staff and patient satisfaction. One clever comment he made that I think of each time I hang an IV antibiotic is, "Stop till it drops." Scott the other staff on the unit when helping make decisions, and he is always willing to learn new things and take on different responsibilities. He looks for new ways to improve processes for the whole unit, thinking outside the box. He led moving our SRA calendar online, which then led us to moving many other things online. He has developed several computer processes that improve his workflow and assist the other staff. He energetically joined the CVU Wellness Committee to look at wellness opportunities on the unit. He had the idea for our Cozy Corner and helped get it set up. He helped research debrief processes and has been willing to be trained to support the team. He assisted in revamping our clerk orientation and has been fundamental in orienting our staff as well as other teleclerks. Scott helps to promote a safe work environment each day he works as he monitors the patient's heart rhythms, reports changes in those rhythms to the nurses, and reaches out to the charge nurses to help communicate information when it is needed. Over the last 2 years, it was evident how pivotal he was to the patient's safety, alerting the nurses to early changes in oxygen saturations in our COVID patients, which allowed for early interventions and improved outcomes. His quick response to alarms prevented patient harm. Working the night shift, he gets the opportunity to answer the phone from some very concerned family members. He engages in conversation and does what he can to make sure they get the information they need. He has listened emphatically and has escalated concerns to the AOD. He treats his coworkers the way he would want to be treated, with kindness and respect. He is welcoming to new staff and very approachable. He will ask the charge nurse to round on new nurses or CNAs if he senses they may need help. Working with Scott, you truly see how he advocates for our patients. Scott is willing to help with anything he can, from making phone calls to other floors and looking for supplies to contacting EVS when there are extra beds in the halls. He puts in work orders for broken equipment and follows through with requests to be informed of patients' heart rate, rhythm, contacting the nurse, and relaying the information in a timely manner. He comes up with clever ideas, cares about each and every coworker, and can always make you laugh. He is an invaluable member of the CVU team that we have all enjoyed getting to know over many years with us. Patients don't get the opportunity to meet Scott, but they are highly dependent on his skills and response behind the desk. They may never know who made the difference in their outcome, but they are comforted by knowing someone always has their eyes on them and he has truly saved lives. Thank you, Scott. Our next winner is Shyla Schluter, a psychiatric technician from the inpatient. Did I say it wrong? Oh, good. She's a psychiatric technician from Inpatient Psychiatric Adult Unit, and she was nominated by Tara Sanders and Carrie Cross. I practiced it. So Shyla has been a representative of psychiatry on the Reducing Unit Falls team. She's always there to volunteer to be part of the solution. She is currently advancing her knowledge and lifelong learning by obtaining her master's degree in special education. She brings back information on how to best provide care under our care. She also attends Unit Partnership Council and nursing meetings regularly. If she sees something that we can do better, she is not afraid to bring it forward along with the solution. Shyla has been engaged in developing the education with the RUF team and will be using it to address the fall prevention. She has assisted in policy revisions and always volunteers to perform the safety tasks. Shyla is always going the extra mile to try to connect with our patients and makes a positive impact. She is the first one to say hello to anyone who is within 10 feet of her. She has advanced into one of our unit clerk positions, which adds complexity and a higher degree of difficulty in our area. This means she has the ability to multitask and prioritize patient and team needs. She is a strong patient advocate and often challenges the status quo for what is considered to be fact versus opinion. To add to her many strengths that have already been identified, she has become a certified foster. This shows the dedication she has to serving those who seek and need specialized care. She is one of our preceptors on the unit and receives positive feedback for her time and tutelage. Shyla is always there to volunteer, even when it may appear to be a daunting or time-consuming task. She is caring and compassionate and truly gives her all to our patients and our team. Patients feel that Shyla is very approachable, a good listener, and makes time for them, even if it is nothing more than listening. Thank you, Shyla. So we have a few, we're going to start into our Friends of Nursing Outstanding. and a wonderful nurse. Thank you, Kelsey. Outstanding nurse. The next winner of our Friends of Nursing Outstanding Nurse Award goes to Kendra Carlson, an RN from Inpatient Psychiatric Development. Kendra was nominated by Tara Sanders, Sherry Haugen, Carrie Cross, and Marcia Regali. Names. Kendra is a well-respected charge nurse whose flexibility across is seen as a value to all team members. She is revered as a sounding board and someone who knows how to get things done. She personifies excellence and inspiration to all nurses and medical professions of every platform. She presents with a beautiful, warm smile, and patients and peers notably receive that first healing intervention of care with appreciation. You might say it is a signature of Kendra's presence as a nurse. Kendra is very versatile. She is willing to learn, ready to apply skill and direction, and respectfully aware of team members. She is enthusiastic in making a difference and quick to defend and implement protocol and safety measures. Kendra has and continues to inspire personal and professional growth in the spirit of nursing. They wrote in words to your name. K, knowledge of. E, empathy towards. N, no nonsense, consistent behavior. D, determined spirit. R, responsible thoughts and actions. A, amazing nursing capabilities. Being a charge nurse in psychiatry is the personification of critical thinking. The ability to do so across multiple units, varying age groups, and navigating all the different regulatory requirements for each is just the tip of the iceberg. She does not stay still for very long, even when it comes to advancing her profession and accountability. She is one of our identified preceptors and receives positive reviews from those she teaches. She has been the recipient of multiple Daisy nominations. She has been specifically identified by some of our patients as the sweet one. She is one of our nurses that goes out of her way to make someone comfortable, even in an uncomfortable situation. Thank you, Kendra. Another one of our nurses for 2022 Friends of Nursing Outstanding Nurse Award goes to Melissa Dinges. She is also unable to be with us today. She is out of country. Can you believe that? She is an RN from our supportive and palliative care and was nominated by Jessica Moorhead. Few things about Melissa. She is an amazing asset to the SCPC team. The devotion and care she gives to each of our patients and their families in their most vulnerable time is outstanding. The hustle and bustle of our department does not sway, nor do patients feel rushed when Melissa is assisting them with a pain crisis, emotional needs, or building a rapport so our team can provide additional support. There's not a day that goes by that our patients call and don't receive a call back before the end of her shift. She provides quality nursing care, but is also an amazing human being. Melissa offers to help and support every single team member, whether it's been an emotional day and we need to talk it through, or brainstorming resources to ensure the patient receives the best care. She works closely with our inpatient teams to ensure proper communication, patient-family involvement when scheduling meetings, and education for new providers on ways our team can benefit their patients, not just for end-of-life care. She takes pride as a nurse and her role. She knows that for patients to receive the best care, she is the front line. She is graceful in taking those frantic calls and uses her years of experience to assist our patients in understanding what is happening. She takes and makes the time for each and every call, walk-in, and appointment. If our patients have a question or an emergency, she is right there to ease their fears and worries while they wait for the provider's information. Melissa has shared multiple ways with the leadership team on her goal and vision for the work that she does. She thinks outside of the box every day, questioning and finding ways we can make ourselves better. This includes, is there a way to divide into inpatient outcome teams? What would we like it to look like, staffing-wise? Many questions outside of the box. There are so many examples that I could share. Most recently, Melissa has worked with a patient for a few months, creating a supportive, trusting relationship. The patient has progressive head and neck cancer, who has a hard time talking and understanding his prognosis. Melissa cultivated a relationship with this patient that allowed him the confidence to reach back out to his stepkids, complete his advanced directives, attended appointments with the patient to hear what providers were saying, and assist the patient in understanding and help him ask questions. She advocated for him to see additional departments that would be beneficial for the patient. Ultimately, when the patient began to fail and was scared, he did not hesitate to reach out to Melissa and share these fears. Melissa works through these fears with him and assisted him in getting set up with hospice services. He still checks in and has developed a friendship that he himself has said he needed most during the lowest point in his life. That speaks volumes as to how she creates relationships and provides outstanding care as a nurse. So I want to highlight that a little bit. Our next winner is Quinta Hoax. She's an RN from the Heights Same Day Care and was nominated by Loranda Bell. Quinta has a calm demeanor and has helped to train new staff that have gone on to be solid coworkers. She has great communication skills and has a great work ethic. She is someone that I can always count on when the day gets difficult or unexpected challenges arise. She gives her all, making sure our patients' needs are met, including questions they may have or post-care needs that arise. She always seems to be aware of coworkers' birthdays and is usually the first to get them a card or flowers. She is very consistent in meeting the demands placed on her by providers and patients. Quinta has an exceptional ability to critically think and an excellent work ethic. She goes the extra mile, tongue twister. She goes the extra mile when taking care of our patients and has stepped up to challenging situations when needed. She's a leader in our department and our facility as a whole. Quinta is ever vigilant and has caught mistakes that would otherwise go unnoticed. She is always on top of situations that require immediate triage of patients and lets appropriate personnel know right away. She is very thorough at her job, is pleasant, and has a great sense of humor. Coworkers absolutely adore you, Quinta. Our next winner is Tatum Erickson, an RN from Inpatient Surgical. Patricia Silver, Curtis Farron, and Clancy Farron. Tatum is a formal leader through her role as a charge nurse and preceptor on Inpatient Surgical. She is an informal leader through her professional practice. She advocates for change on our unit with the goal of improving teamwork and patient care. She is cooperative but also advocates for our team both with the AODs and the PACU staff. Tatum is a member of the Nursing Quality Council. She listens to her coworkers and brings their concerns to the council for consideration. She has developed her practice through actively seeking new knowledge. We have all observed her willingness to participate in all procedures so that she can follow the maxim, see one, do one, teach one. She is never content to have someone else do her work for her. Tatum recently acquired her Certified Medical Surgical Registered Nurse certification. She became a charge nurse on the Inpatient Surgical Unit in the surge of the COVID pandemic, the most difficult time in our hospital, arguably, since it came into existence. She assumed that with that role, with perseverance and courage, she adapted to that role quickly and effectively. Tatum is respected for her attention to detail and advocacy for our team. She works well with all staff and patients, and she focuses on best practices without judgment, is dedicated to the best practice emotionally, physically, and mentally for all patients. Tatum has many discussions with our more knowledgeable nurses regarding safe and effective patient care. She asks insightful and curious questions and expresses her own insights in a keenly intelligent manner. Her goal is always the best patient care and not focused on whether she is right or wrong. She is engaged in unit-specific initiatives such as fall prevention, daily weights, and hand hygiene audits. Tatum doesn't just think through what is happening, but more importantly, why is this happening? She mentors and precepts new team members, both formally and informally. She has a drive to learn and apply all she can to improve her skills and evidence-based practice. Feedback from others on the unit are that Tatum has an inner drive to be the best, and even more critically important, she wants to be the right nurse for our team here on Inpatient Surgical. She listens carefully, continuously demonstrates growth and improvement, and challenges herself. She has shown humility, respect, and the patience to develop into the right nurse for our team. Thank you, Tatum. Switch over to our Friends of Nursing Outstanding Leader Award for 2022. We do have two this year. The first one, Deanna Evans. Deanna, you were nominated by Mary Pankratz and Katie Smith. Deanna is the nurse manager of the ICU, and I have to say, this nomination is 4 pages long. I'm not going to read it all, but it's 4 pages long. It is an incredible show of it, but I do have to read some excerpts because it's pretty amazing. Deanna's pretty amazing. Deanna puts her staff first. She is a strong advocate for staff based on her foundational knowledge as a bedside team member. She stepped into a pandemic and took on a leadership role to support the team, advocate for patient care and staff needs, and has done so in a professional, consistent manner. Deanna has been put in a very challenging role in the best of times. During COVID, this challenge of leading the ICU team has been overwhelming. However, for someone who is still relatively new to the role of manager, she has been incredibly graceful. I can say with confidence that every interaction with her has blown me away. Deanna has a subtle, and sometimes not so subtle, way of challenging you into being a better person than you were before you entered her office. Her commitment to quality is evident in many ways. She celebrates people in the ICU who strive to deliver the best quality care. When someone does not quite reach the mark, she makes sure that it is a learning opportunity, and with her positive attitude, she makes people feel supported in those moments. She's relatively easy to feel inadequate in those moments, but this is where Deanna really sets herself apart from others, by encouraging and making sure people feel supported and heard. Second page. She has, when a need has been identified that we needed additional cooling blankets in the ICU, she made it happen to ease the gap in patient care delivery. This is common for her. When we identify a need that directly impacts staff ability to provide patient care, she works tirelessly to make it happen if it is at all within her power or scope. I have heard Deanna say many times that no one is above the care we provide. This includes taking out trash, cleaning the unit, and wiping down counters. I cannot tell you the number of times I've seen her cleaning or doing tasks that most of us, quite frankly, do not enjoy doing. This directly affects nursing satisfaction and patient care, and the reality is picking up a piece of trash is a relatively simple act. But when you see someone who is a real leader doing it, it makes you take a different level of pride in for your workplace. You realize that this person is there for the right reasons. She empowers her nurses and allows them to be leaders. She's a strong advocate for quality, high quality evidence-based standards. She's known for saying the words, "Let's check the policy." I've never heard her say, "No, we cannot do something that is an evidence-based practice standard." She is dedicated to removing barriers to implementation and supporting use of evidence-based practice and new knowledge. She's the first one to encourage people to join committees. She recognizes the need to get people involved with more than just nursing care to help improve the unit as a whole. I know from nursing experience, even if she does not have the time, she does not make you feel as though she is in a rush to find things or to stop or help. Deanna Evans was the nurse I strived to be when I started in ICU. Deanna transitioned to the quality improvement role specifically to the ICU, and for the short time in which she was in those shoes, the ICU staff knew where we ranked. This is my favorite. I will never forget my first interaction with Deanna. When I was a CNA on a different floor, she showed up as the cat nurse. At the time, I was going through nursing school and having a challenging time remembering why I wanted to be a nurse. I recall being so impressed with her care. She walked in confidently, the type of confidence that makes everyone around her relax because she would take care of things. In that moment, I remember hoping that I could be like her when I was a nurse. That is what a good leader does, inspire others to be better than they were the day before. I believe that Deanna challenges the nurses in such a way that makes us better. Now that I've started as a cat nurse, I can't help but look back on the last few years and remember the many times when she was cheering me on. She has an open door. I have always felt comfortable speaking with her for some words of encouragement, or even to take a minute to reflect on a stressful situation. Her calming demeanor and ability to listen is what sets her apart from others. Not only is she good at listening in the moment, but her follow-up makes you feel appreciated and heard. A true leader is someone who inspires, and I can tell you Deanna inspires me to be a better human. You have many pages of testimonials from your team. Thank you, Deanna.
Thank you. You're a hard act to follow, you know that, right?
I'll just read the story.
Yeah. I'm Lindsey Green. I'm the Vice President of Operations of our procedural division. Megan Jordan, you are here. I wasn't sure you were going to be able to make it, and I'm so glad you are. So I wrote this not knowing if Megan was going to be able to attend, and I'm going to read it as written because it speaks to her character. Megan couldn't be with us today to accept her award. She's home taking care of her little one, which is actually perfectly fitting if you know her, because she's selfless. She puts everyone before her, including her team, which she also considers her family. And I'm very glad you're here, because this goes both directions. You're always here when we need you as well. Like all of you, Perioperative Services has weathered the storm to maintain operations and provide best care for our patients. While doing so, Megan also provides the utmost care for her team, ensuring they are recognized and appreciated for the outstanding care they provide. She runs a very busy surgery center. It's essentially a mini hospital at this point, if you haven't been over there recently. Under her leadership, we've experienced tremendous growth. We opened a 23-hour OBS unit, just to name a couple of the tasks she's accomplished in her spare time. The hallmark sign of her success isn't just volume or growth, but rather the happiness of her team. Rounding and visiting the surgery center is always a treat. They work seamlessly together and very clearly enjoy their jobs. This is the sign of an exceptional leader. If we take care of our team, they will take care of the patients. They know exactly what needs to be done, and Megan selflessly leads that effort. I want to offer my sincere congratulations and heartfelt thanks to Megan Jordan for her outstanding leadership contribution to Billings Clinic and specifically our surgery center team. Congratulations.
I love stories that hit you right in the feels, right? I'd be happy to be a nurse. I am very honored to be able to announce our Billings Clinic 2022 Friends of Nursing Alice Gordon Lifetime Achievement Award this year to Celeste Diamond. Celeste is the former Director of Women's and Children's Acute Care Services, and she was nominated by many, many of us for this recognition. I stepped into shoes that I have no chance of ever filling, so just to help with some of the processes for what she has left behind. But since the day Celeste became an employee of Billings Clinic, previously Deaconess Hospital, she has relied on her gentle and holistic demeanor to create an environment where soon-to-be mothers, NICU babes, and pediatric patients could be cared for with the utmost compassion and kindness. Celeste wears many hats and bleeds purple. She has served on the conference committee for several years and has been a liaison between hospital units, nursing, and administration. Always working towards what is right and fair, she played a large role in our first magnet designation and has been heavily involved in the following two. She has also served on the board of hospital laundry services and has helped bridge some gaps for nursing units across the organization. She has developed programs from the ground up, not only in her service line, but also assisting others in times of need. She developed the LDRP and the IPU from the ground up. And when the OR did not have a manager or director, she stepped in to assist in any way she could. Celeste came to the Billings Clinic with a vision, LDRP. Many organizations around the country use a different kind of model of care, an LDR and separate mother-newborn unit. In her heart, she knew that the LDRP model of care, where families come in, labor, deliver, recover, and stay in their entire postpartum visit in one room, was the best model of care for our patients. It not only prevents the family from moving rooms, it provides continuity of care, which has been proven to be a safer way to deliver that care. Her focus has always been on the safety and quality of the care we provide. She has supported unit efforts in increasing patient satisfaction, and LDRP has been very successful in raising our Press-Ganey patient satisfaction scores. Celeste has a true passion for nursing as a profession, some of which can be told by her own nursing career. She started out as a nurse, went back to school, became a certified nurse midwife, and later came to Billings Clinic to develop our Women's and Children's service line. She lives by the term profession, and that is evident in the way she conducts herself and what she expects of others. She strongly believes in continuing education and not only has supported individuals, but the unit as well as supporting nursing certification and expertise by having the A1 president work with our teams. She has raised and mentored many new staff members, including CNAs, nurses, leaders, and doctors throughout her tenure. She planned and opened the Family Birth Center from initial development to our current state today, and we continue to expand her vision for moms and babes. She has been a director for 20 plus years. She retired in December. She has done the teaching, mentoring, developing, and fine-tuning of many leaders. She believes in people and encouraging leadership. She understands that work-life balance is necessary and has always supported our team to make sure balance is at the forefront. She truly cares about people, where they are in their life, and how to get them where they want to be. She was instrumental in leading the Billings Clinic's magnet journey and reaching the monumental goal of becoming the first ANCC-recognized magnet hospital in Montana, Wyoming, and the Western Dakotas. As the first magnet program director, Celeste initiated a culture of nursing excellence that has stood the test of time as we continue driving to 5 on our magnet journey. She was always celebrating the good things and making sure we share our work and accomplishments. She assists us with telling our stories, many of which she was directly a part of for women in labor. One that sticks out is the use of nitrous oxide in LDRP as a method of pain management. This was something that Celeste had firsthand knowledge about, so when nursing staff asked to have it as an option, she was quick to jump aboard and support our efforts. This ended up being a great magnet story because it was brought to leadership by a staff nurse, and we implemented it about 6 months later. Celeste is kind, caring, and professional, and really listens to staff and leadership. She seeks to truly and completely understand situations, and she has always had a strong moral compass and will always do what is right and fair. And we do miss you at the bedside. Thank you, Celeste. Our next winner is the Nurse Nominated Outstanding Physician Award, and this year goes to Dr. Erin Rains. She's a physician and general. And this well-deserved award was nominated by Mary Pankratz from the ICU. Erin actively solicits nursing's feedback and assessment findings to assist in the development of the patient's plan of care. She is always willing to listen to nursing concerns, findings, and addresses them within the plan of care in a professional, inclusive manner. She encourages the work of the multidisciplinary team with this approach. She actively listens and incorporates what we suggest. I have never once seen her blow off a nursing concern, no matter how small, and she has always consistently responded in a manner that encourages and respects nursing at the bedside. Erin takes time to educate nursing as she goes. This includes with new orders, plan adjustments, or simply by answering nursing questions in a way that shares a deeper understanding and knowledge base with the bedside team. Her leadership in this method encourages and promotes excellence throughout the department. Erin gives full credit where it's due, including nurses, RT, PT, OT, and other disciplines. She recognizes things that are going well and not only lets staff know that she noticed and appreciates, but credits the finding in rounds and during handoff as able. She is supportive of the ICU committees working on new evidence-based practice projects. She actively assists when able, but is also supportive when changes in practice occur, and she can assist in making the process flow better from the provider role. She has been instrumental in getting our nurse practitioners actively functioning throughout the unit. In addition, she is supportive of the nursing staff development program and educates as she can when nurses are leveling up and have questions. She encourages the CCRN certification and values the knowledge base of the advanced education and advanced practice nursing staff. Erin actively seeks out and works with nursing on a plan of care. She is supportive of the nursing students, RT students, dietary students, and medical students who rotate through the unit and includes them in her teaching and patient plan of care when they are around. She is a role model for utilization of best practice, even citing a journal or research study, and provides them to us if we want them. At minimum, she explains the study results and why it changes what we're doing or how we're treating someone. Erin actively supports nursing advancement. This is often seen in her support of our nursing staff pursuing advanced careers, such as nurse practitioner or master's degrees in nursing, and she welcomes learners of all types to the ICU environment. Thank you, Erin, for all that you do for us. So this year's 2022 Outstanding Department Award, no surprise, goes to inpatient surgical. I think we have a few members of their team here. This team is committed to exceeding the minimum requirements for the monthly hand hygiene audits, which is a task we're all trying to achieve. We have been asked to provide insight on our process to aid other departments in fulfilling the number of audits required. We have had staff members on the Nursing Quality and Specialty Council who are active members seeking information and guidance on improving patient care. Our pressure ulcer team is active and guides our unit on safe patient care and preventative treatments. They continually monitor for pressure injuries and provide support for our nursing staff in caring of our patients. We have a very strong partnership council with staff participation on a monthly basis. We appreciate the involvement of all our staff and their input is valued. The inpatient surgical unit has staff who are active on numerous committees. These committees include our morale committee, who is instrumental in engaging our staff and motivating them. All of our staff are members of our partnership council and are required to attend a minimum number of meetings annually. Their input and feedback on the various changes, updates, and new processes contribute to the success of our unit. The Nursing Quality and Specialty Council has had consistent representation from the IPS unit for many years. This team leads the hospital in providing safe patient care by discussing problems, deviations, and recommending strategies to prevent harm. All of the staff on inpatient surgical are members of our hand hygiene committee, and we are leaders in performing these audits. The leadership on the inpatient surgical unit routinely seeks input from our staff regarding changes in patient care and the development of the unit. We have sought out their opinion regarding changing the isolation carts, whiteboards in the patient rooms, changes to the charting on our patients, and other items. Inpatient care has been influenced by our staff participating in nursing research. We were involved in the trials of the Easy Stand and the external catheters, which have positively affected our patient care. Our participation in these trials with the nursing research and evidence-based practice had a positive influence on our patient care. Our staff regularly attend the nursing grand rounds and are encouraged to earn their medical surgical registered nurse certifications. Inpatient surgical unit is supportive of the strategic plan of Billings Clinic. We have many of our RNs who are completing their BSN currently. This is an important objective, and we encourage our nurses to begin to look into options for completion as soon as they are hired. We have a picture of our certified nurses proudly displayed and promote the rest of our nursing staff to pursue this as soon as they have enough hours. Staff satisfaction is a major factor of IPS. Our core staff are strong, even though we have lost some staff over the last couple of years. One staff member phrased it this way: our team has lost many promising and quality new members. We have been bloodied and bowed, but we are not broken. We have determined and renewed energy to continue to hold, carry, and support each other through kindness and courage, which is our greatest strength. We consistently have RN travelers who request to extend their stays on our unit due to the amazing teamwork. In our mission, our purpose: always care, always learn, always forge forward together. This mission statement from Billings Clinic speaks volumes about the inpatient surgical unit. We have newer RNs who worked here at the hospital as a CNA during nursing school, and they chose the inpatient surgical unit as their unit due to the culture of uplifting new nurses, and all the staff want everyone to grow. Asking questions is encouraged, accepted, and promotes a sense of acceptance and safety for the new staff. One of our staff members had this to say: our staff are some of the most genuine, kind-hearted people I have met, and I do believe that like attracts like. And in this case, the similarities among each other are all positive ones. The staff of the inpatient surgical unit are very transparent, and among an amount of social drama, which can drag down the attitude on the unit, is non-existent. The staff on the inpatient surgical unit look out for each other and help each other to grow. A staff member stated, as a new grad RN starting during a pandemic, I experienced fear, chaos, and uncertainty of self, but this team helped me to not sink, but to swim. After a while, I felt like Michael Phelps. As Helen Keller so aptly stated, alone we can do so little, together we can do so much. Congratulations. And thank you.
Quality and Safety Improvement Team Award. This year, this team undertook the initiative to eliminate wrong site surgeries. Wrong site surgeries are complex events, most often with multiple failure points or opportunities, from the scheduling of a case up to and including time in the operating room. This is something we as a team, as an organization, shouldn't be ashamed of, but rather speak openly to in order to identify risks and work collaboratively to mitigate them. The consent process we designed is 5 simple steps, initiated by the surgeon and clinic team, which then carries over to perioperative services. The nursing teams ensure all of the steps are followed, and as a result, we've since seen a complete elimination of wrong site events since late 2020. This includes 0 wrong site events for 2022. It's important to note that near-miss reporting has increased as well. This is what we want to see. We want to see team members reporting any concerning occurrences so we can improve. Further tailor our process as a highly reliable organization, and this team certainly encourages that open dialogue and feedback. This award represents the ultimate collaboration from physician champion Dr. Dole with assistance from our chief of surgery, Dr. Pender, and of course, a nursing-led process improvement in both the surgery center and main OR, which includes our registration team, pre-op, and OR staff. These teams are all empowered to stop the line and to speak up for patient safety, something they do every day with courage and grace. Congratulations to the perioperative services leadership team. I want to specifically recognize Kimberly Mangle, manager of the main OR, Tracy Labor, hospital surgery, and Amanda Hill, our surgical services consultant, but soon to be team member. Fisher, our clinical coordinator, and of course, Megan Jordan, our surgery center manager. Thank you all.
Able to celebrate so many great people here at Billings Clinic and the excellence of the care that they give at the bedside. So another round of applause for everyone. And thank you to all of the families who came today. It's truly, you're supporting our team members to be successful at work, and so thank you for your commitment to your family members so that they can do the work that they do. A round of applause for families. All right, take time today to celebrate yourselves and take care of yourselves and have a wonderful afternoon. Thanks, everyone.